The past few days, there have been nurses and doctors that have been turning up at these press conferences at 11 a.m. every day. And I'll be serious, don't watch these things anymore. The numbers, they do what they do, but it's all about the vax rate. I'll tell you that each and every night. I'll tell you what the date is. But I've got to say, the people who are the actual front line here, not the politicians, not all the other people that are suffering right now, I just want them to really know how thankful that we are. We don't ever want to take for granted what these people do. We also have to be really aware of the stress and strain that's on them, because there's all different reasons why the system ends up under strain. Now, obviously, number of cases can be one thing, but also trying to protect the people who work in hospitals is another. Like, there are huge numbers of people who have to leave working in a hospital or leave working in the health system for 14 days because they might have come into contact with someone with COVID, and that means they have to go into isolation, just like if somebody here or at your work ended up having a COVID scare. So there's that pressure that's on the system as well. But I just want to say tonight, if you are somebody who is in that healthcare system, if you're somebody who is all day, every day, and it feels like every day gets worse, I just want to say thank you. Honestly, bottom of my heart, thank you. The politicians, that's another issue. Which is why we need to also talk about making sure that we have a robust health system to take care of the people who have many other issues than COVID right now. I can't believe in New South Wales they are still mucking around with people's ease to get breast screening if they think they might have cancer. Because here's the reality. There is a woman during this lockdown who has found a lump and has put off going to find something out about it. That can be catastrophic for some women. It's something we have to keep talking about, and it's the type of thing we need to bring back with the same urgency that we need to bring back schools and business and all of the other things that we've talked about, because it is just a matter of life and death, and it is a huge issue. And Vicki Durston is the Director of Policy and Advocacy at the National Consumer Breast Cancer Organisation, and she joins us now. Vicki, that's the truth, is that there's someone who has found a lump in the past 10 weeks who hasn't had the same ability to go off and get screened like somebody who had found a lump even this time last year in New South Wales.
Yeah, look, thanks for having me. I think there's certainly concerns that we are seeing, and it is complex in the sense that when breast screen is closed, we're not able to see those early detections and hence that early intervention. But then there's also the other element of those people that are at home in lockdown that may have concerns or symptoms that are not leaving home to go and get that explored or go to their GP for a multitude of reasons. So it is concerning, because what that will mean is those delays in diagnosis and those misdiagnoses that will then present at a later stage.
Now, the Northern Beaches of Sydney, perfect example, right? Northern Beaches of Sydney is where the Health Minister, Brad Hazzard, is the member for Wakehurst. It's a place where thousands of people have signed petitions to want to get access back to this screening system, but the Minister for Health is choosing to support the shutting down of some of these screening systems due to the issues in and around COVID-19. Does this make sense to anyone when the Health Minister isn't doing everything he can to make sure that a health measure like breast screening is freely available to a population in Sydney where the cases are not in their hundreds or even in their dozens?
There's certainly an appreciation by the community and by organisations that staff need to be redirected to support the COVID crisis. But I think what we want to see is a plan out of this, and we want to see that resourcing to support the backlog of appointments. So that's what we're calling on, and that's what we want to see.
All right. So give us an idea about the next stage in all of this, where presumably you're in the ear of the Health Minister. What are they saying? Are they just giving you the sort of good old-fashioned Little Britain computer says no? What are they saying here? Because, you know, they'll tell me to buzz off, but good luck telling you or your members that.
Yeah, look, we're working really closely with the Cancer Institute and the government and really welcoming those conversations. They are talking to us, but we're still calling on that plan. We do want to see that roadmap out. But I think what we also want to hear is that that confidence that's instilled in the public that our health system is open and that people with symptoms will be seen to. And so we want to see that strong messaging of don't delay, cancer won't wait. And that's what we're calling on, that really strong public health messaging to our community that it is safe, that it is important to go and get checked. Because it's those people that are sitting at home that are fearful of going to their GP because they might get COVID, or they're not prioritising their health because the messaging is stay at home. So we need that strong public health messaging to say, although breast screen might be closed for a short period of time, we do have a roadmap out of here, but if you do have a concern or symptom, please go and get it checked.
All right. Thank you very much, mate. I do appreciate it. Thank you very much for the chat.
Thanks for your time.